Welcome back to MicroMedMark. Hopefully I'm not yelling because I got a microphone in now. Well, it's a beautiful May day here in 2021, except it isn't. We're in the middle of a gas shortage, so everyone's losing their collective minds. It's just another day. All right, so let's get into it. Today we're going to be talking about vancomycin. Okay, so one thing I forgot to mention in my intro video is that I currently work at a major trauma center in the Atlanta metro region as an IV technician. Now, I'm still a pharmacy technician, but what I do is something called sterile compounding using aseptic technique. One of the biggest fast movers that I compound is IV vancomycin. They come in various strengths ranging from 1250 all the way up to 2 grams from what I compound. So I make vancomycin and a plethora of other medications as well. Stay tuned in the future to see those videos. So vancomycin's primary indication, particularly in its oral form, is for C. diff or Clostridium difficile. But it's also prescribed for MRSA infections, cellulitis, and due to very limited bioavailability, it's not too often that it's given in a tablet form. If it is, it's almost exclusively used to treat C. diff. Okay, so Clostridium difficile. If you've taken your medical microbiology class, the reason this may look somewhat familiar is because it's a gram-positive bacteria. So who remembers gram-positive and gram-negative?
For a quick review, gram staining is a lab technique used as a tool in differential diagnosis between a gram-positive and a gram-negative bacteria. Basically, retention of the pink safranin dye indicates the presence of a thin layer of peptidoglycan and a layer of lipopolysaccharides. What does this mean? This means that we're dealing with a gram-negative bacteria. Vancomycin under these circumstances is of no use to us. Retention of the crystal violet dye, however, indicates presence of a thick layer of peptidoglycan. This will tell us that we're dealing with a gram-positive bacteria, and that's where vancomycin will enter the equation. Let's go into a bit more depth.
Well, there are a few key terms I'm going to hurl at you. Maybe it's a review for you. Maybe it's a completely new language. Either way, we're going to break this down real simple so you can understand vancomycin's mechanism of action. Okay, so we're going to start with probably the most important term of this video, peptidoglycan. In addition to peptidoglycan, we're going to have terms like N-acetylglucosamine, N-acetylmuramic acid, transpeptidation, amino acids such as alanine, Clostridium difficile, already talked about that, cross-linkage, cell wall synthesis inhibition. This is kind of important. Now that we've gotten all the important vocabulary out of the way for this video, let's start to focus on the key terms. I want you guys to keep in mind peptidoglycan, as mentioned earlier, cross-linkage, and cell wall synthesis inhibition. Alright, some super basic review here. We have a standard bacterial cell. There are going to be different parts of its outer layer, so to speak, including its cell membrane, capsule, and the cell wall, which is going to be our target for vancomycin. So vancomycin is a cell wall synthesis inhibitor, which means it's going to give the bacterial cell a very bad day. Let's see how. So the bacterial cell wall is made up of thick layers of this stuff called peptidoglycan. What we're looking at here is peptidoglycan showing the alternating residues of N-acetylmuramic acid and N-acetylglucosamine. NAM, NAG. Cool. Now these peptidoglycan layers are connected to each other through what's called cross-linkage of amino acids, mainly including alanine and lysine. Throwback to biochemistry, good times. So vancomycin will inhibit a process called transpeptidation, in which alanine and lysine are blocked from further constructing that peptidoglycan bridge, preventing any more cross-linkage. Okay, so here vancomycin is binding to the D-alanine terminal end of the peptidoglycan side chain, and vancomycin does its job. Cell wall synthesis is effectively inhibited, which results in cell death. Alright, not too scary, right? Now that we've gotten that out of the way, let's look at some contraindications for vancomycin.
Kidney function is a big deal, and with vancomycin, renal failure is of paramount concern. You see, our bodies need to be able to properly excrete the medication from our system before it amounts to toxic levels. Vancomycin trough readings are checked periodically by the patient's nurse for this reason exactly. Some elderly patients, or those with otherwise less than optimal kidney function, will likely receive a decreased dose. Hypersensitivity to vancomycin and drugs with similar chemical properties are also contraindicated, as well as pregnancy.
Okay, so now we're going to go into some adverse effects. One of the biggest adverse effects is called red van syndrome, and it's what's called an anaphylactoid reaction. Usually it's related to an infusion rate, so slowing down the rate of administration can help mitigate some of the symptoms. There's going to be a lot of red, itchy skin in the face and upper body. A couple other adverse effects include nephrotoxicity, and ototoxicity. All right, so up until this point, we've covered primary indication, mechanism of action, contraindications, adverse effects. We're going to wrap up with patient consultation.
So guys, really as far as patient consultation goes, thorough communication between patient and provider should always be maintained where possible. This includes disclosure of past medical history of hypersensitivity to vancomycin in order to prevent an allergic reaction from occurring with the patient. And secondly, although technically not a point for patient consultation, providers themselves should also maintain open lines of communication between one another to avoid therapeutic duplication.
Okay, that's it. I'm done blithering now. Hopefully you guys are still with me. That pretty much sums it up for vancomycin. Hope to see you next time. Tune in to MicroMedMark.